Ontario Premier Doug Ford has warned of strict measures being put in place if ICU admissions in the province get any higher. And today, they are as high as they were at the peak of the pandemic. Now, Ford is floating the idea of a pre-Easter lockdown.
Everything's on the table right now, so folks, be prepared. I'm asking you, don't make plans for Easter.
Ford says new restrictions could be coming. The province has surpassed its highest number of ICU patients since the peak of the pandemic. Dr. Anthony Dale from the Ontario Hospital Association tweeted this morning. 421 patients now in ICU with COVID-related critical illness, 32 admissions yesterday. This is the highest number of COVID patients in critical care at one time since the pandemic began. BC, Alberta, Saskatchewan are all also dealing with infection rises. All three provinces seeing more than 100 COVID-19 patients per 100,000 residents. Dr. Lisa Salamon joins me now. She's an emergency physician in Toronto. Good morning to you, doctor. To lock down or not to lock down? What's your take right now? Is it time?
Yes, Marcia, unfortunately, it's time to lock down. It probably was time about a week ago, but we really don't have any choice. As you just said, we now have 421 patients in the ICU in Ontario. If you recall, back in January, when we had 420 patients in the ICU, we were already approximately 2 weeks post lockdown. And so we knew based on the trajectory that we were close to a plateau. Right now, lots of things are open. Schools are open, outdoor patios are open, outdoor gyms are open, and we've been seeing this exponential rise, especially with the variants of concern. So if, Premier Ford doesn't pull this emergency brake ASAP, like in the next day or two, we're going to be in big trouble.
Is this a Toronto problem? Is this a GTA problem?
I think right now it seems to be a GTA problem, but we're seeing pockets in all sorts of places that are having high rates of COVID as well. It's sometimes just diluted in their public health units, and so it's not as noticed when small centers or small hospitals have these large numbers for their particular community. So I am hearing around the province that this is the case in smaller centers, and that's a problem. But what also is concerning is the GTA is sending out our patients to many hospitals in other cities in the province in terms of ICU. And that's concerning because as soon as you bring COVID into other areas, there's always the risk of creating outbreaks or spreading from those patients, even though we're really, really careful. So while it starts in the GTA, it tends to spread outwards.
This is happening ahead of Easter weekend. We're in Passover. How concerning is it for you that we are seeing cases the way we are? We're seeing ICU filled up the way it is heading into a long weekend, because we know, doctor, that following long weekends, a few days after, the numbers start to peak again because people are getting together.
100%. So we saw this at Christmas. We saw this at Thanksgiving. My family just celebrated Passover last weekend, and for the second year in a row, we were on Zoom once again without, being able to see our family members in person. And again, coming into Easter weekend, and I hear people say, "Oh, well, just be a few of us getting together." But every time we do that, we see huge exponential rise. And what's different this time is the variants of concern are much more contagious than the original strain. So I really, really have a lot of concerns with this long weekend coming, particularly that this is the first time where we have the highest numbers in the ICU. And I can tell you personally, what I'm seeing on the ground in emergency this week is really, really bad. Our volumes in the emergency department are getting up to our pre-pandemic volumes in terms of number of patients. They're sick, both patients with COVID and patients who don't have COVID. And I saw, if you can imagine, on Monday, 6 patients with COVID, just my shift alone. 2 went into the ICU and 2 were hospitalized, and they're pretty young.
Final question for you. You and I both know people are sick of this. They're tired of it. It's been over a year, and a lot of people are saying they just can't do another lockdown. Are there any other alternatives, Dr. Salamon?
The problem is that people, when we try to open up businesses, and I really do think that some of these small businesses are really safe to be open. The local stores down the street from you where only 1 or 2 people are going in, those aren't the cause of the outbreaks at all. What's concerning is things like schools, where we're seeing more and more schools being closed, more and more kids getting infected, bringing home to their parents. But unfortunately, it's the confusing messaging as we open up things and trying to support these local businesses. People think that it's okay to gather, to congregate. So really, unfortunately, I think that the message needs to be clear. We're all tired. I'm tired. I'm sure you're tired. My family's tired. We're all tired of this. But really, I have to say, all of us frontline workers are really tired of what we're seeing. We're seeing really sick people right now. And unfortunately, I wish I had another solution. I really do, but I don't think we have any other choice at this point.
Dr. Salamon, great to see you this morning. Thanks for being with us, and we'll talk to you again really shortly.